So one of the most common questions is why does an implant rupture? Is there something I do that makes an implant rupture? And the reality is no. Most of the time, implants rupture just due to the age of the implant, and it's just normal wear and tear on that silicone shell on the outer surface of that implant. And that's why the older the implant gets, the higher the risk of rupture. Then the other question people have is a rupture bad for me? So obviously if you have a saline implant and it ruptures, it's salt water and it's absorbed by your body, and then you'll just have that empty shell, which will need to be removed. If it's a silicone implant that ruptures, it depends if it's an intracapsular rupture or an extracapsular rupture. And what that means is when we have a breast implant, we form a capsule around it because our body thinks that's a foreign material and it needs to protect us from that. So if the silicone implant ruptures, but the silicone gel is confined to staying within the capsule, then you have plenty of time to have it removed and or replaced because that capsule is keeping that gel from getting into your surrounding tissues. If it's an extracapsular rupture, meaning that now that gel has gotten outside of the capsule, it can get into your breast tissue and even your lymph nodes and cause some sort of deformities, disfigurement, or lumps in your breast and surrounding tissues. Part of the reason why you want to have the implant removed when it's still intracapsular is you want to avoid it becoming extracapsular and causing all those other problems. People will ask, is a ruptured breast implant going to kill me? No, it's not. So it's not an emergency, but I would definitely recommend having it removed. The other thing that's important to remember about breast implants is just like all types of technological devices over the years, our technology has improved. So a lot of the older implants had a thinner outer silicone shell, meaning that because it was thinner, the wear and tear was greater, so the rupture rates were higher. And the gel inside was less cohesive. And so once that outer shell ruptured, that gel was more apt to get into your tissues. Okay. Today's generation of silicone implants have a thicker outer shell and a thicker, more cohesive gel inside. So that means that today's implants have a lower risk of rupturing and will rupture much later than the older implants. And if they were to rupture, since that gel is more cohesive, it's more apt to maintain its configuration and stay intracapsular.